Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through December 22nd, 2022. As this is the last weekly update before the holiday season, I want to wish you all a very happy and healthy Christmas, New Year's, whatever you celebrate, and however you celebrate it. I hope it's a good one for you and your family. This week, I want to address a question that's come in several times over the year and that I haven't previously addressed, but it really is important, and that is, what should I know about fentanyl? The headlines have been full of stories about fentanyl, including one that just came out yesterday that said the U.S. seized enough fentanyl to kill every American in the United States, and one that said that it's now the deadliest drug threat facing the United States. And this isn't just hyperbole. If you look at the history of overdose deaths over the last 20-some years, you see this light blue line just start to explode about 7 years ago. And that's synthetic opioids, primarily fentanyl. And that's through the end of 2020. And by the middle of July, in the 12 months leading up to July 2022, there have been over 100,000 overdose deaths in the U.S., of which at least 2/3 are due to fentanyl. That's about 150 deaths a day. And that's a really significant problem. And as I say, that was through the end of 2020. So that's about here. So you can see that it has continued to go up even since then. And if you look at our state of Tennessee, it's been going up pretty steeply. And here's a website, if you want to jot this one down, you can go there and look up your state in terms of deaths. So this one sentence pretty much sums up everything you need to know. It's a synthetic opioid that is up to 50 times stronger than heroin and 100 times stronger than morphine. It is a major contributor to fatal and non-fatal overdoses in the United States. It's probably helpful to think of two types of fentanyl. One is pharmaceutical, a prescription drug. It's a Schedule II narcotic. It's legally manufactured in the United States with what we call good manufacturing practices, and I'll come back to that. And it's legally prescribable, and there are some brand names there. But it's the other type, the illicitly manufactured. Some people call it illegal fentanyl or street fentanyl. Be careful with the illegal term, because it can apply to both the pharmaceutical one that can be illegally distributed. But this is talking about what is generally called illegally manufactured fentanyl. It's done by illegal manufacturers. There's all sorts of street names. I never like street names for drugs, because the moment someone uses them, it sounds like they're trying to sound cool. And if you ever want to not sound cool, try to sound cool. Fentanyl works like other opioids on the body's opioid receptors, particularly in the brain. It can have diminishing effects over time. It does affect other parts of the body as well, notably the intestines, which is why constipation can be a common side effect. Now, the reason illicitly manufactured fentanyl is so dangerous is because it is made in unlicensed, unregulated labs. So drugs made in the United States not only have to be approved by the Food and Drug Administration to be shown that they're adequately safe and effective for their given indication, but they also have to be manufactured with what we call GMP, good manufacturing practices. As you can imagine, illegal labs, especially those in other countries that are smuggling drugs into our country, don't abide by those manufacturing practices. And unfortunately, once the fentanyl is made, either overseas or in the United States or wherever, it can then be mixed with other drugs. And sometimes that is done in labs that look even less savory than the ones that produced it. The problem is, if fentanyl is mixed in with any other drug, you cannot tell by looking at it, by tasting it. In fact, there's no way to tell without testing. how much fentanyl is in a product. And if you think about it, if you were making pills from a powder, mixing things together, unless you are a really sophisticated manufacturer like a pharmaceutical company, you're not going to get that product evenly distributed. And the problem with fentanyl is a small amount, the amount that can fit on the lead of a pencil can be fatal, can be lethal. Fentanyl has been found in a number of street drugs, as well as some prescription drugs that are knockoffs. And it may or may not be found in other things. There's a lot of urban legend going around about where fentanyl is found, but basically it can be found in pretty much any street drug that's designed to have a psychoactive effect on you. And the challenge, of course, as you can see on these files, it's very difficult to tell the illegal knockoff fentanyl-laced drug from the original product. And if you remember, 2 milligrams can be lethal. Now, fentanyl, like any opioid, can be addictive, but the real concern with it in the short term is that it can cause a significant and fatal overdose. So the signs of someone who might be going through an opioid overdose are small, constricted, pinpoint pupils, obviously falling asleep, losing consciousness, and then suppression of the breathing, slower breathing, limp body, cold, clammy skin, and especially starting to turn blue. Basically someone is dying. If you suspect that you see someone who is overdosing, according to the CDC, call 911 immediately. Administer naloxone, Narcan, if it's available. Try to keep the person awake and breathing. Lay them on their side to prevent choking, and stay with the person until emergency assistance arrives. According to the CDC, if you know someone who is at increased risk of opioid overdose, especially those struggling with opioid use disorder, you should carry naloxone and keep it at home. I would go a step farther than that, and that is if you know anyone who is buying illicit drugs on the street, I would have naloxone with you at home. It is available from a number of sources, but it can also be a bit expensive. And so perhaps it might be the perfect Christmas gift to buy yourself or buy someone else. It quickly reverses opioid overdose in a couple of minutes, which is great if someone is dying because the breathing is suppressed. It can keep them alive. It may require more than one dose. And importantly, it is generally safe, even if the person is not overdosing on an opioid. But they need to be monitored because it can wear off and they can go back into breathing suppression. It is available in all 50 states. Check with your pharmacy, community-based drug treatment organizations, and so on. Now, according to the CDC, Good Samaritan laws are in place in most states to protect those who are overdosing and anyone assisting them in an emergency from arrest charges or a combination of these. And I would encourage you to be cautious because if you read state laws, they sometimes have caveats in there about who can and cannot do it. Having said that, if someone is dying, do whatever you can to keep them alive. All right. And if that means administering Narcan to save someone's life, that's obviously the thing to do. The CDC also recommends the availability of fentanyl test strips. It's a low-cost method. It's just a way of testing whether there is fentanyl in a product, and they provide people who use drugs in their communities important information. And they say, look for organizations that distribute them. There's a great flyer from the Tennessee Department of Mental Health and Substance Abuse Services that talks about fentanyl test strips. So if you or someone you know is at risk of overdose, they say keep naloxone readily available on you and at your home. Avoid mixing drugs that can have an additive effect. They say be careful because drugs that may have been safe on the street before may not be anymore. They say never use drugs alone. And importantly, ask for help. There's a federal website listed here. where you can find treatment. And there's also an 800 number, but it's very important to ask for help. So what should you know about fentanyl? Well, obviously it is a serious public health problem. 150 deaths a day is a very serious issue. It is growing, at least it has been. It may be leveling off now, but basically it looks like many street drugs that are designed to have a central nervous system effect, may be laced with fentanyl. And if they are, the amount of fentanyl may vary from very, very little to a lethal amount. So please be aware of that. ETSU is very fortunate to have an outstanding addiction science center. If you go to the College of Public Health website, you can find a link to them. Please feel free to reach out to them. They have some of the best experts around, and they're well connected, both regionally and nationally. Obviously, as always, please feel free to share this video with anyone who might be interested. I'd like to thank Dara Young for producing, adding captions, and posting this video. And as always, if you have any questions about what I've said today, or you'd like an update on any other public health issue, please let me know. Even over the holidays, I'll be checking my email, and I'll be happy to respond to you if I can, or refer you to other folks. So until next week, please be well and have a wonderful holiday season. Thank you.